Good evening, everyone. I'm Dr. Prasanna. Today we talk about different pelvic spaces in gynecological surgeries. Okay. So first, initially, I want to tell one bony landmark in the pelvis, which is very important. That is sacral promontory. Okay. So this sacral promontory is the area where the common iliac artery vessels will divide into internal iliac and external iliac vessels. Okay. Second, the ureter which is coming laterally, it crosses medially at this level of sacral promontory. Third, at this sacral promontory, there are many plexus. The hypogastric plexus is there. This hypogastric plexus will become nerve, that is superior hypogastric nerve and inferior hypogastric nerve. This occurs at the level of sacral promontory. And the last important point is when you dissect inside the pelvis, when you feel sacral promontory, at that point you should notice that yes, this is the part where we can find parietic lymph nodes. So sacral promontory helpful to note the parietic lymph node dissection. Okay, these are important landmark point of bony prominent point in case of pelvic surgery. Now we learn about pelvic spaces. So what are these pelvic spaces means? Actually, these are all virtual spaces. They are really they are not a particular space present, but according to our need and according to our ease of surgery, we made these virtual spaces so that we can. There is very importance for each and every space in the each and every pelvic space, and there is significance also. And we should find which what are the contents, what are the boundaries of these spaces, so that while dissecting we can avoid any unnecessary injuries. Okay, so there are bilateral pelvic spaces and unilateral pelvic spaces. Bilateral means the paired pelvic spaces. Okay, one is bilateral pelvic spaces, paravesical space, that is bladder side. There are two spaces, that is paravesical space. Next is pararectal spaces, that is rectum. There are two spaces, one is pararectal spaces. And coming to unilateral, that is single pelvic spaces are, one is retropubic space or else prevesical space. That means if you think this is bladder, if you think this is bladder, so before the bladder there is a space known as space of rhesus. Space of rhesus. This is known as prevesical space or retropubic space because it is behind the pubic symphysis bone, right? Then second unilateral space is rectovaginal space. That is rectum and vagina has between there is space known as rectovaginal space. Third is behind the rectum. That is retrorectal space. Okay, behind the rectum. If you think this is rectum, if you think this is rectum, then behind the rectum there is a space. Behind the rectum there is a space known as a retrorectal space or presacral space or presacral space. Okay, so three unilateral spaces and two paired bilateral spaces are there. Now we'll learn what are the boundaries, what are the contents, how to identify them. Then finally, I'll show some laparoscopic images so that you'll have a clear-cut picture in your mind. What is that space and boundaries? Okay. Very important questions will be asking. Like they'll give that space diagram and they'll mark one point and they'll ask what is this structure going on into this space, or else what is the importance of this structure in that. Okay. So we'll learn that. So I hope you can see my whiteboard. Okay. So first we learn about spaces, right? Right? All the spaces. So I'll again repeat the spaces. That is bilateral space. That is parabicycle space. And sorry for the glitch. Okay. So the bilateral spaces. That is pararectal space and paravesical space. Okay. Unilateral spaces are retropubic space, retropubic space. Then you have rectovaginal space. Then you have retrorectal space. Okay. These are different spaces. Now we learn about boundaries. So all these structures, all these spaces down, there is levator muscle, levator muscle, levator muscle, and above there is a peritoneal lining. And above roof is generally made up of peritoneal lining. So this is common. So most probably these are common points: peritoneal lining above and below is the levator muscle. Okay, these are all our virtual spaces so that vital structures can be avoided. Injury can be avoided with the vital structures. Okay, so first we learn about parectal space. Pararectal, pararectal space. Okay, so this rectum side there space is known as pararectal space. So generally the roof of this pararectal space, if you see, okay, if you think this is a rectum, okay, I hope you can see. So if you think this is a rectum, there's the two spaces here. These two spaces are known as pararectal spaces. So above the roof is made up of broad ligament, that is peritoneal lining, broad ligament. Then medially there is rectum. Medially there is rectum. Laterally there is interiliac artery. Laterally there is interiliac artery. If you see this, medially there is rectum. Laterally there is interiliac artery. Then floor already I told, which is formed by levator and muscle. Anteriorly, there is uterus, which is having the cardinal ligament. Anteriorly, there is uterus, which is having the cardinal ligament. And posteriorly, there is curvature of levator muscles. Okay, the curvature of levator muscle is present. Cranially means just above, there is uterine artery. And contents inside this pararectal space. This is very important. What are the contents of this pararectal space? That is external iliac artery, uterine artery, ureter, superior hypogastric. So, one artery, one vessel, there are two types of arteries, and there is one ureter, there is one nerve. Okay, so what are the contents of pararectal space, which is very important? External iliac artery, uterine artery, ureter, and hypogastric nerve. Which hypogastric nerve? Superior hypogastric nerve. You understood? So this pararectal space are of two bilateral pararectal spaces. That bilateral pararectal spaces and pararectal spaces above is by broad ligament, which is peritoneal lining. Below is by levator muscle. Okay. Medially is by rectum. Laterally is by means of interiliac artery, which becomes a content as well. Sorry. Yeah. Uh, Laterally is internal iliac artery, content is external iliac artery. Okay, remember that. So they'll ask this. So laterally by means of internal iliac artery and content is external iliac artery, and branch of internal iliac artery, that is uterine artery, and there is ureter, there is also superior hypogastric nerve. So these are the contents of pararectal space. Okay, they will ask compulsory, they'll ask what are the boundaries. Mm. We'll write the boundaries so that you'll understand. So the pararectal space boundaries. So if you think this is the pararectal space and this is the intestine, okay. So roof is by broad ligament, broad ligament. Floor is by levator. Medially, medially is by rectum. Medially is by rectum. Laterally is by means of again levator, and also the internal artery. So there is internal artery like this. If you see, there is one internal artery here. It is giving a branch which is going inside this. Okay, and there is one more letter. So contents of pararectal space is external iliac artery, uterine artery, external iliac artery, uterine artery, ureter, ureter, ureter and superior hypogastric. No, superior hypogastric. Okay, these are different contents of parietal space. So they'll ask you what is the relation, what is it, what is this thing like parietal space, what is the relation? It is generally the anteriorly it is separated from the anteriorly it is separated from cardiac ligament. Anteriorly the cardiac ligament separates it and posteriorly by the rectal septum. Okay, so there are two types of approaches by entering into the parietal space. If you see parietal space, you can enter the parietal space medially. You can enter the parietal space laterally. Medially is by means of is known as endometriotic approach. Medially is known as endometriotic approach. Medially, if you approach, that is known as medially is known as endometriotic approach. Okay, endometriotic approach. Whereas laterally it is known as oncological approach. Okay, because endometriosis generally is very close towards the midline. Okay, whereas laterally you will go for dissection in case of oncological surgeries. Okay, that is lateral approach. Okay, so, what is why this medial important? Medial approach is important because once you open the medial rectal space, medial pararectal space, then it is generally the incision is given just medial to the infundibulum. If you see this, if there is infundibulopelvic ligament, so medially you will give the incision and we'll dissect the peritoneum and enter the medial pararectal space. Okay, once you enter, you can see ureter. Once you enter this medial, if you think this is a medial parietal space, once you enter this parietal space, you can see ureter. Okay, you can see ureter. Okay, by means of that, you can find out whether this is a medial or lateral. Okay, so and what is the importance of this name means if you're while entering this space, while entering this parietal space, if you feel any bleeding, if you feel any bleeding, then you lift the you can find the ureter by means of peristalsis. So you lift the ureter. If you lift the ureter and the bleeding stops, that means the bleeding is from uterine artery. If you lift the ureter, then bleeding is not stopping. That means the bleeding is from uterine vein. Okay, you understood? So uterine artery, it is above the ureter, and uterine vein is below the ureter. Okay, so you know this water under the bridge concept. Um, so there is water under this bridge. Okay. So if you lift the ureter and it is the blood supplies, blood bleeding is stopped. Bleeding is stopped. That means the bleeding is from uterine artery. It is not stopping. That means the bleeding is by uterine vein. Then you will like it in that. This is the importance of this area. And mainly you can you go into the space while dissecting endometriosis. Okay. Lateral approach is you'll give incision lateral to the infundibulopelvic ligament. Infundibulopelvic ligament laterally you'll give this incision and you'll proceed. Okay, then so this medial medial space, medial pararectal space, this medial pararectal space also known as this medial pararectal space also known as Okabayashi space. Bayashi space. Whereas lateral is known as Latsko space. Latsko space. Okay. So lateral L for L, but medial is by Okabayashi space. Okay. So that is important. They'll give different names also. Then Latsko space boundaries. Immediately they'll ask what is Latsko space boundaries. Same. Ventrally, anteriorly there is carnal ligament, dorsally there is presacral fascia, lateral aspect of sacrum. Okay, laterally again internal iliac artery. Laterally, always there is internal iliac artery. Okay, if you see always the internal iliac artery forms a lateral boundary. Then medially you have ureter and mesoureter. In case of Glasgow space, medially you have ureter. Understood? The space is basically divided by means of ureter. So if it is medially to the ureter, that is medial thing. If it is lateral to the ureter, it is lateral space. Okay, you understood? So that's about importance of Lasco space and this thing. And dissection of Lasco space is mainly when once you dissect it, you can find the uterine artery. Okay, so Lasco in Lasco space only you'll dissect and you'll find the uterine artery in case of uterine artery ligation. So in case of PPH, first you need to identify the infundibulopelvic ligament. Okay, and in the near the infundibulopelvic ligament, laterally you'll cut open the peritoneum and you'll dissect carefully and you'll find the ureter and at just once you find the ureter, okay, just above the ureter you can find the uterine artery. So you'll find the uterine artery and you ligate that. The same way you'll repeat on the other side for bilateral uterine artery ligation. Okay, then okabiosis space. I already explained about okabiosis space, and contents of this okabiosis space, that is medial space, is superior hypogastric plexus. Okay, basically there are two important structures in okabiosis space. Okay, there are two, in case of medial part, there are two anatomical structures. There are two anatomical structures. Okay, one is lateral ligament of rectum, other is medial rectal artery. Okay, lateral ligament of rectum, other is middle rectal artery. Okay, that is middle rectal artery. These are very important because these two, that this ligament, okay, this ligament and even this artery have their own connective tissue, and mainly if you avoid this tissue, these two structures, that means that is a nerve sparing kind of surgery, nerve sparing surgery. Okay, and Okawasis space is a nerve sparing surgery. Pelvic lymphadenectomy also, and the pelvic central lymph node dissection also seen in case of medial. So I said lateral space is for uterine ligation. So pelvic lymph node dissection is mainly done in Okawasis, that is medial space. Even in deep infiltrating endometriosis, careful dissection is done in Okawasis space. Okay. And third important significance of Okawasis is Luna. Laparoscopically, the uterosacral nerve ablation is done. Okay, so what are the importance of Okawasis space? One, you know, Okawasis space one, the nerve sparing surgeries can be done. Two, pelvic lymphodissection is done here. Three, the Luna is done here. Okay, that is laparoscopic uterosacral nerve ablation. Then, mm, then you have paravesical space. So paravesical space means I already told that. So the paravesical space which I am telling you, these are just besides the bladder. So just behind, besides the bladder, you can see two paravesical spaces. So they are just lateral to the urinary bladder, and if you see the spaces, the pararectal space are a little inferior, and paravesical space a little superior. Okay, if you see the plane. Okay, so pararectal and paravesical spaces actually they'll communicate. Also with the prevesical space as well. Okay, so basically the paravesical space boundaries, obviously like same as pararectal spaces is also same. First thing, medial is by bladder, middle is by bladder, lateral is by lateral pelvic wall, inferiorly. Okay, inferiorly is by uterine artery. Whereas in pararectal space, uterine artery is a content of pararectal space. But in case of prevesical space, inferiorly only uterine artery is there. You understood? So it is way above. This space is way above. You understood? Way above, and this pararectal space is way below. If you see, the pararectal space are way below, and paravesical space are way above. That's why the uterine artery is inferior to the paravesical space. Okay, and contents of this are, there is a obliterated hypogastric artery. You remember obliterated hypogastric artery, which is a medial umbilical ligament. You remember that? Yeah. So that is present. Okay, medial umbilical ligament. So this medial umbilical ligament is dividing this paravesical space into this medial umbilical ligament will divide the paravesical space into medial and lateral. Okay. And obturator and pelvic lymph node dissection is done because of paravesical space. Okay. Let's learn about different images so that uh, you'll have an idea. Can you see my screen? Yeah. Okay. So let's learn different spaces. Let's see some of the images of different spaces so you'll have an idea. Okay. So see, these are different structures at the level of sacral promontory, and we can see the bifurcation of the common iliac artery. Okay, there is a bifurcation of common iliac artery here. So in somewhere here, somewhere somewhere here around there is sacral promontory. Okay, somewhere here around there is sacral promontory. So the sacral promontory from here that it is divided into internal iliac artery and external iliac artery. You can see that internal iliac artery and external iliac artery, and side you can see the ureter. Okay, then see, this is a psoas muscle. This is a psoas muscle which we can see, and the external iliac artery, which is giving the inferior epigastric artery. Okay, always the artery is very big, big, fatty one. Okay, and vein you can see blue one. Like images in we used to study, the red is artery, blue is vein. In that way only it will be visible. See, the vein is external iliac vein is blue color. Okay, and arteries are red and fat. Okay. If you see the ureter, here you can see the ureter. You can see the ureter, which is always lies medial to the internal iliac artery. So internal iliac artery medially. So if you see, ma'am, how can I find whether it is medial or lateral? Always find the this thing. Always find your rectum. Okay, this is a rectum. Okay, so that means here it is medial. This side is medial. So always the ureter lies medial to the internal. Ureter lies medial to the internal iliac artery. So whenever you find the internal iliac artery, that is whenever you find the ureter, the beside structure, beside artery is internal iliac artery. Remember that. Okay, from internal iliac artery there is a tortuous artery coming out, that is uterine artery. uh, this is the obturator nerve and obturator vessels. Okay, first initially only you will see the obturator nerve, then below is obturator vessels. So these are seen in case of paravesical space while dissecting the obturator lymph node. Okay, so once you see the obturator nerve, you should stop dissection, because why? It's not injury to the obturator nerve. Obviously there will be injury to obturator nerve, but behind that, below that, there is obturator vessels. If there is injury, there will be so much of bleeding, and it is a deep pelvic surgery. Then I told na the ureter is between the uterine artery and uterine vein in that way. So ureter is between the uterine artery and uterine vein in this image. Okay, so this is a very clarified image which shows how is the lateral pararectal space and medial pararectal space shown. Okay, if you see this is a peristaltic structure. This is a peristaltic structure, that is ureter. Okay, and there is uterine artery here. So ureter medial to the ureter is known as medial pararectal space. Lateral to the ureter space is known as lateral pararectal space. Okay, so basically the uterine artery comes and becomes a part of pararectal space. Okay, and uterine paravesical space is way above the pararectal space. That's why in paravesical space the uterine artery becomes the inferior border. Okay. Mhm. See, I already again told you the ureter is medial. Always ureter is medial with the internal iliac artery. Okay, and this is left rectal space. Okay, and if you see this image, this is a denovellar fascia where there is uterus and there is rectum. So behind the uterus and between uterus and rectum, there is a space known as denovellar fascia. Okay. There is also a fourth space, that is known as Yabuki space. It is basically the anterior space. Okay, it is a retroperitoneal space which is confined anterior surface of the uterus and the ureter inserting into the bladder. So your ureter going into the bladder and the anterior surface of the uterus. These two between that space is known as Yabuki space. So it's a retroperitoneal space under the intravesical fold. It is bordered by ureter anteriorly and anterior surface of the uterus posteriorly. Okay. Yeah, these are different spaces. I hope you understood. Thank you. We'll meet in the next video.